Hi, I'm Dr. Shahangian, pediatric dentist over at Scripps Pediatric Dentistry. And today I'd like to share with you a little bit of information about a true dental emergency, and that is a tooth that gets knocked out, or what we call an avulsion. This actually does happen more commonly than you may think. Interestingly enough, in my practice, it's mostly girls soccer players. Now, this can happen in our bathtubs, it can happen in our living rooms, in places that our kids spend the most time in fact. So better to be prepared than not, certainly. So first of all, I want to highlight, if your child has a significant trauma, make sure that they're okay first and foremost, right? If there's any concussions or any significant issues like that, we have to get that addressed immediately. Assuming that there isn't anything like that, your dental traumas are best managed by a pediatric dentist, and especially if it's an avulsion or a knocked out tooth, every minute counts. So please find your nearest pediatric provider. Your general dentist and emergency rooms aren't as comfortable dealing with these sort of things, and you may be losing precious time. So we do not generally reimplant a knocked out baby tooth. So if you're unsure whether this is a permanent tooth or a baby tooth, if you're not sure if it's the full tooth or part of the tooth, you shouldn't have to worry about it. We're going to go through the same sequence either way. And the highlight is there are certain cells on the tooth that we want preserved if we're going to reimplant that tooth successfully. And every minute counts. Those cells need to be kept in a biological medium or be placed back into their location of origin so that they can survive the traumatic incident. When you are going to pick up the tooth, you want to make sure that you stay off of the root. So instead of grabbing the root, I'm going to make sure that I pick the tooth up by its crown, as I don't want to touch the cells that are called cementoblasts. Then ideally, we would be placing the tooth right back into the socket. Now, this is way easier said than done when it's on a model and it's not your child. The field is quite bloody, and we want to make sure that if this is not something that you can do at the time, you have your plan B. So plan B is, once you pick up the tooth, you want to make sure that you rinse. Now, I have normal saline here, but if you have water, because you're probably not going to carry normal saline with you, you rinse very lightly, very gently, just the root structure in case there's any debris. We're not going to scrape, we're not going to scrub, just very lightly you're going to rinse. You will find something that can hold the tooth without it getting lost or it essentially getting tossed around too much. You're going to put a biological medium, and again, cold milk is what's normally utilized, but what if this is on a soccer field? Well, if you don't have normal saline, your child unfortunately will have plenty of spit and or blood to donate to you at that point in time, and if it's their blood and spit, it's way preferred, but plan C would be your own blood and or spit. Again, I know it's kind of gross, but we know that if we allow this tooth to dehydrate within minutes, these cells will die, and vice versa. If we drop that tooth and those cells in a container filled with water, osmosis will rush water into the cells and it will burst them. So in short, if you don't have cold milk, your biological medium will be saliva and or the blood that the child is holding in their mouth. You have them pull enough of it where you can drop the tooth in there, keep it safe and secure, and you're going to rush to your nearest pediatric dentist. And at that point, they can determine if this is a primary or a permanent tooth. And if it's a tooth fragment, the same. This sequence can help provide lots of useful information to your pediatric dentist. I hope you'll never have to deal with something like this. But feel free to share this with your children's coaches, their uncles and aunts that take them out to the parks. And if you guys have any other questions or comments, please feel free to share them with me, and we're happy to make more videos. Hopefully you find this useful, and we'll see you guys next time. Thanks so much.